Welcome to the Medline University hosted course, G-Tube Care and Maintenance. This course was developed by Tanya Dixon, RN, able to discuss the purpose and rationale for placement of an enteral tube, describe site care and maintenance, and list the process for monitoring an enteral tube. Upon completion of this course, the learner will be able to discuss the purpose and rationale for feeding and medication administration, site care and maintenance, and list the process for monitoring an enteral tube. The state of being fed by a feeding tube is called gavage, enteral feeding, or tube feeding. A feeding tube is a medical device used to provide nutrition to patients who cannot obtain nutrition by mouth. This may be due to an inability to swallow safely, an obstruction of some kind, or from a neurological or musculature deficit. Oftentimes, individuals may just need nutritional supplementation. This nutrition is delivered directly into the GI tract by a feeding tube. Routes may be surgical or non-surgical. The tube may be placed in the nostril, called a nasogastric tube. It may be placed directly into the stomach wall, which is gastrostomy, or it may be placed through the jejunum, which is a jejunostomy. Tubes may also be placed in a combination of these locations. Placement may be temporary for the treatment of acute conditions or lifelong in the case of chronic disabilities. A variety of feeding tubes are used in medical practice. In Module 1, an overview on the use of, types of, and indications of enteral tubes are explored. The state of being fed by a feeding tube is called gavage, enteral feeding, or tube feeding. A feeding tube is a medical device used to provide nutrition to patients who cannot obtain nutrition by mouth. This may be due to an inability to swallow safely, an obstruction of some kind, or from a neurological or musculature deficit. Oftentimes, individuals may just need nutritional supplementation. This nutrition is delivered directly into the GI tract by a feeding tube. Routes may be surgical or non-surgical. The tube may be placed in the nostril, called a nasogastric tube. It may be placed directly into the stomach wall, which is gastrostomy, or it may be placed through the jejunum, which is a jejunostomy. Tubes may also be placed in a combination of these locations. Placement may be temporary for the treatment of acute conditions or lifelong in the case of chronic disabilities. A variety of feeding tubes are used in medical practice. The medical provider determines when and if an enteral nutrition tube should be placed. The selection of an enteral access device requires an evaluation of the patient's disease state, GI anatomy, taking into account past surgeries, gastric and intestinal motility and function, and the estimated length of therapy. The decision must be made regarding whether to place the distal tip of the enteral access device in the stomach or small bowel. In general, gastric access relies on a functional stomach that is free of delayed gastric emptying, obstruction, or fistula. A person may have an enteral tube placed if the individual has the inability to meet nutritional requirements. If an individual is unable to take food or fluids by mouth, or is unable to swallow normally and/or safely, they are also a candidate for an enteral tube. There are several reasons why an individual may have difficulty swallowing. Click to reveal additional indications for enteral tube. There are several reasons why an individual may have difficulty swallowing. Click to reveal additional indications for enteral tubes. Accidents, such as motor vehicle accidents or other forms of trauma, may occur, which may affect swallowing. Cancer in the area may impair swallowing. Neuromuscular problems, such as nerve damage to areas, affect swallowing. The individual may experience a decreased or absent gag reflex, which may impair swallowing. The individual may have facial paralysis, which may impair swallowing. The individual may experience edema, which may impair swallowing. A tumor may obstruct an area, making it difficult to swallow. The individual may have limited awareness and not have the ability to recognize swallow or gag reflex. At other times, the individual may have suffered from a disease or disorder, such as a stroke, dementia, cerebral palsy, or muscular dystrophy. Let's first take a closer look at the digestive system. Stomach, small intestine, large intestine, and includes digestion and elimination. The digestive system can affect nutrition, which may require placement of an enteral tube. Knowing how the digestive system works will assist you in knowing what abnormalities to look for. Click each aspect of the digestive system to learn more. Digestion is the breakdown of food into molecules that can be absorbed and used by cells of the body. Digestion begins in the mouth by the action of chewing and the addition of salivary glands, which initiates carbohydrate digestion. Digestion continues in the stomach, where food is mixed by the musculature action of the stomach, and gastric juice is added. Because some of the gastric juices in the stomach are acidic, the stomach does have a protectant called mucosa. Digestion continues to the small intestine, and the small intestine is where digestion and absorption of nutrients takes place. Finally, in the large intestine, water and salts from the material that has not been digested as food is absorbed, and waste products left over are eliminated. Digestion is the breakdown of food into molecules that can be absorbed and used by cells of the absorbed, and waste products left over are eliminated. It is important to understand placement of enteral tubes, which It is important to understand placement of enteral tubes, which varies. Short-term enteral devices. Nasal or oral insertion of an enteral access device is often performed at the bedside. Nasojejunal tubes may be placed with the assistance of endoscopy or fluoroscopy. Confirmation of correct position of a newly inserted tube is mandatory before feedings or medications are administered. A variety of bedside tests to determine tube placement are used with varying degrees of accuracy. Whether a tube is initially inserted or being used, there needs to be a mechanism in place which verifies placement of the tube. Tubes should be verified prior to any food being placed into the body cavity. The gold standard for confirming correct placement of a blindly inserted enteral access device is a properly obtained and interpreted radiograph, or X-ray, that visualizes the entire course of the tube. Click to learn more about each type of feeding tube. A jejunostomy, or J-tube, is necessary for individuals who cannot obtain adequate nutrition through the stomach and have severe gastric reflux, stomach obstructions, or intestinal motility problems. A J-tube is a feeding tube that is placed by a doctor through the abdomen into your small intestine, jejunum. Feeding into the jejunum bypasses the mouth, esophagus, and stomach. The tube is placed in the jejunum, middle section of the small bowel, through an opening in the abdominal wall, or through a specific port, and provides food and liquids directly in the jejunum. A nasoenteric feeding tube is placed through the nose and advanced until it reaches the stomach or small intestine. Different size tubes may be used. Nasal tubes may be inserted for a variety of reasons. Those include for removal of gas and fluids, to diagnose GI motility, to relieve or treat an obstruction, to provide means for nutrition, hydration, and medication, to promote healing post-op, or to remove toxic substances. Remember, nasogastric tubes are usually placed temporarily. A gastrostomy tube is a feeding tube that is placed by a doctor through the abdomen into the stomach, bypassing the mouth and the esophagus. A tube feeding supplies patients with nutrition when oral intake is not possible. Feedings may be given to the patient as a supplement or to provide the patients with total nutritional needs. Do not be alarmed if you provide care to a patient that is receiving both oral intake and an enteral feeding. A skin-level G-tube button is a short feeding tube that comes out level with the skin. It has a cap that opens and closes and a tube that is attached just for feedings. The Mickey allows intake of food, medications, and water. An inflated balloon at one end, in stomach, and an external base at the other, outside on the skin, both hold the tube in place. They will last up to 6 months. The anti-reflux valve is located inside and toward the top of the feeding port. This helps prevent stomach contents from leaking out of the tube. The extension set will open or unlock the valve. Balloon volume should be checked weekly via nursing. Be sure residual formula is not left to pool and dry inside the valve opening, as this can clog the tube. In Module 2, different methods of tube feedings and nutrition are discussed. The physician chooses tube feeding formula based on the patient's nutritional needs. The consistency of the formula, the size of the tube, the method of delivery, and the convenience for the patient are all considered. Many times, the primary care provider will ask a dietitian to consult and determine nutritional needs. Dietitians will also calculate water needs and determine the amount needed to flush the tube when administering medications. Dehydration or malnutrition can occur when the patient's nutritional needs are not met. In Module 2, different methods of tube feeding the method of delivery, and the convenience for the patient are all considered. Many times, the primary care provider will ask a dietitian to consult and determine nutritional needs. Dietitians will also calculate water needs and determine the amount needed to flush the tube when administering medications. Dehydration or malnutrition can occur when the patient's nutritional needs are not met. Click to reveal key terms that you should be familiar with. Gastric residual is food, liquid, or material from a previous feeding left in the stomach at the start of the next feeding. Intermittent feedings are feedings administered at various intervals throughout the day. Continuous feeding is a continuous drip feeding, which may be delivered without interruption for an unlimited period of time each day. Bolus feeding is a set amount of feeding usually delivered 4 to 8 times per day, with each feeding lasting about 15 to 30 minutes. Each feeding time varies based on healthcare provider orders. There are several different types of tube feedings: intermittent gravity, syringe bolus, and continuous pump. Click each method of tube feeding to learn more. The intermittent gravity feeding uses a feeding set with an attached bag that holds the formula. Gravity pulls the formula through the feeding set. Intermittent feeding is given in short periods of time throughout the day. Intermittent feedings are defined as being delivered either by a pump that runs continuously throughout the day and is discontinued each night, or as a 4 to 6 hour volume feeding given over 20 to 30 minutes. Intermittent feedings allow the stomach to rest at night and more closely simulate normal eating and nutrient absorption patterns. The syringe bolus is a method of giving a large amount of formula over 15 to 30 minutes several times a day, as tolerated. This is considered a gravity feeding. These feedings are administered above the level of the stomach and are dripped into the stomach by gravity slowly, or given as a bolus feeding over a few minutes. Both are administered by a large syringe. When feedings are administered, the patient must be placed in a sitting position or high Fowler's to reduce the risk of aspiration. The continuous pump is a method for giving formula over an 8 to 24-hour period. The pump allows small amounts to be given over a longer period of time. Pumps are set at a specified rate to control the speed of the feeding being delivered to the patient. Enteral feeding pump products are continuous or intermittent and help improve the quality of life for patients requiring assisted nutrition delivery. Pumps may be electric or even battery-operated. Enteral products come in a variety of designs. Enteral pumps may come as portable pumps, stationary pumps, and may be used in homes, hospitals, or on the go. Most recently, there has been an enteral pump for children and young adults, which is stored in a backpack, which maintains some privacy. Pumps typically come with a specific delivery bag, kit, or packaged product. They also may come with disposable sets and accessories that make it easy for patients to get the nutrition they need, whether they are in their homes, in hospitals, or on the go. In Module 3, Preparation of Tube Feedings and How to Deliver Medication Using Enteral Tubes are explored, including the do's and don'ts of medication administration. Click to reveal ways to prepare for a tube feeding. Cover and refrigerate any unused formula. Be sure to label it with the date and time. It should be discarded after 24 hours. Remember, formula changes should not be done without a doctor's order. It is important to check the formula label, ensuring it is the correct formula. Ensure formula is at room temperature. Shake the container well prior to administering the formula. Check the expiration date, ensuring that the formula is not expired. Let's talk for a minute about water and its role with patients with an enteral tube. The source of water may differ depending on the patient. Several forms of water may be used. However, the Aspen Institute recommends the use of a purified or sterile water for irrigation supply, for formula reconstitution, and medication dilution. Consider purified water for enteral access device flushes in at-risk patients. Wipe off the top of the can and ensure that bags or pre-filled bottles are intact and formula does not appear to be clumpy. Bolus feedings are given via a syringe and are administered at specific times. Click to learn more about each step when administering bolus feedings. When administering a bolus feeding, wash your hands with soap and water for 15 to 20 seconds. Next, gather your equipment. When the nurse is preparing any type of feeding, the healthcare provider's order needs to be verified. Now, you need to don clean gloves. Be sure to explain the procedure to the patient. Verify placement. This is the most important step and must be done each and every time. When you are administering a tube feeding, Have the patient sit up at least 45 degrees during the feeding and 1 hour after the feeding to prevent aspiration, which is tube feeding coming back up from the stomach into the lungs. Once placement is verified, administer the bolus feeding. Make sure the patient is able to tolerate the amount of the feeding. Clean the work area to help prevent infection. It is important to understand the techniques of bolus feeding administration. Click each technique to learn more. When tube feedings are administered, residual feeding amounts are checked at specified intervals, hourly when initiated and every 4 hours thereafter. This is to ensure that the feeding is being absorbed. The amounts mentioned here are not set in stone. Residual is the amount of formula and gastric fluid left in the stomach 4 hours after feeding to determine if the previous feeding has been digested. Stomach contents are normally yellow or clear unless there is food in the stomach. Residuals indicate slow gastric emptying, therefore increased probability for regurgitation and aspiration of gastric contents. The stomach may not always empty completely. The amount will vary depending on activity level or position. Always replace residual to prevent possible electrolyte imbalance after noting color and amount. Doctors will typically provide orders on when to hold or stop a feeding based on residual parameters. You should routinely check for proper placement. The appearance of gastric contents implies that the tube is patent and in the stomach. If no gastric content appears, the tube may be against the lining of the stomach or may be obstructed. If you meet resistance as you aspirate for stomach contents, stop the procedure and notify the primary healthcare provider immediately. Pour the prescribed amount of water into the barrel of the syringe. Release the tube and allow water to slowly enter the stomach by gravity. Pinch or clamp off the tube just prior to the syringe being completely empty. Slowly pour formula into the barrel of the syringe and unclamp the tube to allow the formula to enter the stomach. Continuously refill the barrel before it completely empties to prevent air from entering, until the entire prescribed amount of formula has been poured into the syringe. Pinch or clamp the G-tube just prior to completely emptying the syringe. Flushes maintain patency and provide hydration. The enteral tube is typically flushed at intervals every couple of hours to maintain patency of the tube. The primary healthcare provider will indicate the amount of flushes and the time frame for each patient. Regarding the residual checking, verification, and amount, all of this will vary per patient and according to the primary healthcare provider. Flushes maintain patency and provide hydration. The enteral tube is typically flushed at intervals every couple of hours to maintain patency of the tube. The primary healthcare provider will indicate the amount of flushes and the time frame for each patient. Regarding the residual checking, verification, and amount, all of this will vary per patient and according to the primary healthcare provider. Pre- and post-care facilitates the downward flow into the individual's stomach and assists to prevent esophageal reflux. It also assists in ensuring that your tube is patent. Now let's discuss post-bolus care. Click to learn more about each step. The first thing you want to do is flush the tube with the prescribed amount of water. This facilitates movement of any additional formula or medications that may have just been administered. This also ensures that the line is clear. The next step is to disconnect the extension feeding set from the port of the tube. After disconnecting the extension feeding set, flush the tube and then reinsert. This ensures that the patient does not have excess spillage from the tube. After a bolus feeding has been administered, you will maintain the patient upright for at least 1 hour to prevent aspiration. Always clean, dry, and store your equipment after use. Doff gloves and perform hand hygiene. Lastly, be sure to document the procedure and the tolerance of the bolus feeding. When administering medications per tube, wash your hands, prepare the medications per policy, assemble the equipment, and explain the procedure. Be sure to position the individual appropriately, don gloves, connect the extension tubing, and check for residual and placement, as well as replace residual and clamp the tube. An excessive amount of residual may indicate an intestinal obstruction. The nurse should be following the doctor's orders and notifying the healthcare provider if residual is below or past the stated amount according to the doctor's order. When administering medications through a tube, the nurse is responsible to ensure that the medications are in a form in which they can easily go through the tube. Often, this means that the medication has to be in some sort of liquid form. Typically, the healthcare provider will order the G-tube to be flushed before, between, and after medication administration. This will vary based on the healthcare provider's orders, so be sure to check the order prior to administering. Pour liquid medications directly into the diluting liquid. Stir well with a spoon. Liquid preparations should be used whenever possible to avoid obstructing the enteral tube. Crush pills finely before mixing with warm water. Shake suspensions vigorously before pouring. Follow medication administration procedure by pouring at eye level and from opposite side of the label. If there are medications ordered for a patient who receives medications via G-tube and they are in oral form, the nurse should be calling the doctor to receive an order to change the pill from a solid to a liquid form. After administering medications, disconnect the extension set, cap off or clamp the tube, keep the individual upright for 1 hour, and document the procedure and observe. Some medication delivery practices may lead to adverse patient outcomes, specifically tube obstruction, reduced drug efficacy, and increased drug toxicity. Here are some practices that will help ensure medications are delivered safely and accurately. Flushing tubes before or between medications. Administering drugs separately from one another. Diluting liquid medications. And avoiding crushing modified release dosage forms.